start to introduce ourselves, starting from Sister.
Assalamu alaikum. Hello.
Speak English.
Okay, I am Fatima, Principal Nurse at bwiam General Hospital.
Assalamu alaikum. My name is Usman Sagar, Quality Assurance Manager, bwiam General Hospital. Assalamu alaikum. I am the Deputy CEO.
Assalamu alaikum.
Good morning, I am Usman Nandi, Hospital Administrator.
Good morning, Kevin Manager, Chief Executive Officer.
Assalamu alaikum. Hello, Almammeh Gibba, Phone, Tanzania.
Assalamu alaikum. My name is Salim Brady.
Thank you very much for the introduction.
Thank you very much, Chairperson. Welcome, Honorable. Once again, as usual, it's also customary for National Assembly members to go around and look at the facilities under their purview, know where they are, how they are, and where they want to go. So we discuss what they are our mouthpiece. They are also our medium of communication through the higher office. And you can all agree with me, and one has been a vocal person, not only in the National Assembly, but for this hospital. From the beginning, but I've been working with him closely on the development of this facility. And he has taken it very seriously. Because there are a lot of problems that have been going on in this hospital, from the leakages, to the limited resources that we have. Where I cannot reach, we have the possibility to reach there. So I always say this, that we have a very strategic location. We are surrounded by 5 hospitals, supported by 5 national assembly members, 5 chiefs, and a whole lot of community leaders, and so on and so forth. So we're very lucky in our consequences to have 5 national assembly members. I always say, whatever we want as a region, if we are united together, we can definitely have it. Because each of those members are representing a committee in the National Assembly. And if you look at it, health is a cross-cutting project which runs across all the committees within the National Assembly. I always say this to them, and I always say it anywhere else, that it's important that we work together as a region so that we can bring the progress of this, not only the health facility, but also all other socio-economic activities in the region. So we're very delighted to have the Honorable here again. We've been here last year or year before last. It's also good for us to see how far we have gone in terms of progress and what are still the bottlenecks and how we can mitigate them. A lot of them will not come slow, will not come quickly, but then at least if we know that we are on the right path and we know that there are steps that have been taken, within a short possible time, we'll be able to achieve them. So that's why I'm always very happy to have the Honorable around, because it's important for them. It's not even also important for us, but it's also equally very important for him to also report, you know what I mean, what is happening in his constituency, especially if you look at the whole of West Coast region. This is the only hospital within the West Coast region too. The whole of West Coast region. bwiam is the only hospital. So that is why I always say bwiam is very strategic. So a lot of things could have been happening by now, but like we said, better late than never. We hope that in the coming months or so, there'll be a transformative change in terms of development in this hospital. And then we hope that will also attract a lot of experts. This place will become, how do you call it, it's going to be an eye-catching facility where so many people in the future would like to work for this facility. Because we all have to be cognizant of the fact that infrastructure plays a very important role in terms of attraction. Motivation does not only come from money alone, satisfactory working condition. And when we mean satisfactory working condition, if the staff have the right tools, the right personnel are available, with the right materials, they are motivated. In the past, we cannot attract so many people here because of the infrastructure. So many people don't want to come and work here because when you come, people come and find you in a condition, in an environment which is not appealing. You don't want to be associated. But everybody wants to be associated with good things, with beautiful things, with nice things. So that is what we intend to achieve in the coming months or so. And then we hopeful, as we started together, it was never going to end. But the more we are developed, the more we are improved, the more our needs also grow in terms of finance, in terms of service. So we will need more money. Like when there is development, like look at the road construction along the Vital Highway, rent automatically will increase, fare will increase. So development comes like that. We always want development, but it comes with cost. So once we are also improved to a certain level, our infrastructure needs will, our overheads will increase. We will need more fuel, we will need more electricity, we will need more food for patients, you will need more drugs, you will need everything more. So this is what brings about, that's what development brings about. So to have the Honorable, they are the ones who are really responsible for whatever comes to us in terms of budget. And then with this also give him an opportunity, you know what I mean, to also know beforehand what are those gaps that what are the major problems that we have now, and then what we think what can also be done in order to mitigate some of those problems. Basically, this is why it's always very important we report back to them. Normally, that's what we do. We report back. Instead of us reporting back to them, they are coming to visit us and also to see it for themselves. Remember, I can say Honorable had a lot of he has been knocking the doors of the minister when it comes about this the leakage that we are facing here. That I always say this should not happen in the 21st century. Definitely anywhere in terms of as far as our health care facilities are concerned. But at least thank God there have been a lot of advocacy and there have been a lot of positive development in that area. So we all say that this advocacy has really paid dividend. It has really yielded, positive outcome. So we will continue to advocate. We will continue to bring the agenda until that, like I said, I am not from here, but I am from the Gambia, and then health has no boundary. Wherever you are, you never know what's going to happen. Would I stop lighting this road? No. Anything can happen to you. The first point of call will be this hospital. So that's why I said people should always look at things. Like, for example, when we say make the mile 2 prison convenient, you don't know whether you will go there or not. You know that when you are making laws, make good laws, because some of those laws might come back again to preside over your case. So that is what we are just saying. When we do healthcare, when we do this hospital, we want to do it like one of the best homes, so that when the patient comes here, it's not about the drugs. People's mindsets are always on medication, drop. But let me tell you, 50% of all our health outcomes are dependent on the facility. So people sometimes they are not sick, they are stressed at home. They just want to come and get a sanctuary from the hospital where they will have peace of mind, to either to be away from pressure from their wife at home, or pressure from the husband at home. All these things happen. So that's why hospitals should be treated like a home, better than even a home. It should be a healing place. So we also want to make sure that bwiam Hospital also becomes a healing place, so that at least the people around these areas also deserve a better healthcare facility where their quality of lives can also improve so that we don't want to see so many people coming to the hospital. That is not also a good sign. The more people coming to the hospital is not a good sign. You know, that it means there are no much, improvement. We want people to be well, we want people to be healthy, so that less people will come to the hospital, and there will be less expenditure also on health. So this is some of the things that we just want for you to understand why we always want to make sure. I, for one, I always make sure I work with, wherever I am, I work with my National Assembly members, because I know they are the ones where they can reach, their voice can reach. I cannot reach there. If I talk, they might see me as political or something like that. But if they talk on behalf of the entire region. Sometimes personally, I don't even have to do this thing. I will sometimes channel certain things to them, on a more private manner, and then they know how to bring it to the other levels. So that is why we always have to make sure we work with them, so that we all improve the region. And then at the end of the day, he might not be a National Assembly member tomorrow, I might not be a CEO, but other people will also come, they will emulate some of those bad examples that we have set for ourselves. Honorable, on that few notes, I say, welcome once again.
Thank you very much, CEO. This is where I know our catchment area has gone to 68,000, right? The previous that we have been using. And I know by this conclusion of the statistics, we have grown a bit. But notwithstanding, it is about time we improve this hospital. It's about time we improve the welfare of our people. And I would want to seize this opportunity to thank the Honorable also for being the mouthpiece of bwiam General Hospital. Many a time we had him on social media, many a time we had him on all other platforms being the cry of bwiam General Hospital. He has gone to our minister several times to discuss about the leakages of bwiam General Hospital. And thank God, few months down the line, we were here to inaugurate, I'm sure you sent a representative, to inaugurate the start of the World Bank project to see how do we innovate this hospital, and to assure you that the innovation work have started. And so my colleagues are here, and also your team is also here. We can see that the work has kick-started and they are progressing with the construction of the residence, generator, and the new kitchen. They are only waiting on us to evacuate some of our staff so that they can start the renovation work, because some of the delay we had was because of the rains, and during the rains they could not remove the roofs. So these are some of the reasons. But so last week Friday and yesterday we had a lot of engagement with the team that is on the ground to begin to relocate some of our service areas, so that I know with time we'll have to close some of the service areas and continue to run the general outpatient units, because it demands a lot, because almost every structure in this hospital needs renovation. So some of those units will be closed temporarily, maybe for a week or two before the service will continue. But notwithstanding, and so we'll allow the CEO, the Honorable, to take the discussion, and we'll always be behind you to give you 100%.
I'm sorry.
Yeah.
I think there are very important areas that we have to look at. One of them is, we all know, in a hospital setting, we generate waste. And this is very dangerous. It's a time bomb. So waste, generation, waste collection, transport. Another area that is very fundamental. Yes, as Steve has said, drugs and people. But essential drugs are very important to be available. We have like people to be able to have access to those drugs at reasonable prices. If the government is not bringing the drugs, the private sector will bring the drugs and they will inflate it. At the end of the day, who is going to suffer? Those are the underprivileged, the poor are going to suffer. Especially provincial government like here going upwards and so on, where we don't have pharmacies. We call drugstores. No, they don't provide the basic essential, for the emergency drugs and so on. They are not authorized for. So it will bring a very big problem to the society. Another area of very important is accommodation. Because if you want service to go, you need skilled personnel on the ground. And they need to be accommodated. And you know, all these people cannot be, going for rental in these settings and so forth. So you need to provide accommodation for them. So that at least they're able to stay for a longer period and be able to provide the quality services needed for the population that they are serving and so forth. This is very key too. Then when it comes to specialists, you see, economically, if you go to studies back, the number of referrals that we are sending, some of them can stay here. If you send me and I'm poor and I'm going to buy you and so forth, the cost there for me as a poor person or my relatives, look at what is going to be incurred in that period. So that means that places like, as you rightly said, this is a very good setting. We are very strategically located. Before referrals going up to Banjul, there's Canada. And it can go to cost on the government, both on families and their members. I think even they will be able to keep up on them. That's what we call development. But we are still at the same place. Every time, how many times is the ambulance playing this road to Banjul and so forth? How many is government paying there? It's a lot of millions and millions of dollars.
To riders.
They have to ride us. This is going to somebody's pocket. But how we call it that development? So these areas are very key that we think we... Now, another important thing. If I have a museum, only one museum that is operating, for instance, sterilizing museum, and only one for these big hospitals, and it's serving how many thousands of populations, that small museum alone. And then there's no backup.
And it breaks
You don't
down.
have to break down now. There's a service will kaput. There's no operation going on, there's no quality service going on. So that means that we have to buy machines and have a backup. It doesn't end there, but we have to train people again who have to look at these people, not only when the machine have a breakdown, but to service the machine so they stay longer. Then we'll be able to at least keep something from the machine that we have bought. But if you are not servicing the machine, and then at the end of the day, when it got kaput, that's the end of it. Where are you going? Nowhere. So these are very important areas that we need to look at. That's what I always say. That's one thing I always say. I say, look, if I'm the director of health or a health planner, what should I think of? How many health facilities have been in this country? How many? But how many of them are fully operational to standard? Why don't we put an embargo? No more building of hospitals, no more building of health facilities. The money we generate now, we look at equipping bwiam to be a fully functional hospital. In the next 5 years, Banjul and so forth, until they are fully fledged. Then you think of expanding again. But the way you are expanding, the way you are using more resources, and skeletal staff in that place, at the end of the day, you will be able to achieve your main objectives, aims and objectives. That's how I say things.
Yeah. So I think you're making a point because I didn't know. Maybe we have to change the discussion point because the issues that you are bringing, those are some of the issues that we want to discuss with him. Maybe after this thing. Because like I said, Honorable is also going to the National Assembly by next week. You know what I mean? Then they will also be debating on budget and the like. At least some of the points like stuff like someone just alluded to. When we talk here, maybe we're not only talking on behalf of bwiam, we're looking at the national interest. Just now, they just called me. They want to know how many accidents occur this year on this road. You know what I mean? So you want to imagine, we had almost, someone just told we have about 103 accidents. You know what I mean? That occur on this highway, recorded. About 349, involving about 349 people or so. You know what I mean? How many deaths? You know what I mean? So these are some of the things that all have to tell us that something is really not happening. You know what I mean? Yesterday, there was a German training, police training, something, and then they said January to December, January to February, but the Harding Highway, there have been almost about how many accidents, involving almost about 20-something deaths. January to February. But when they started deploying a system within the highway with the police patrol, they said the accidents reduced to 4. You know what I mean? Something like that. So I see some of these things, the same things will have to be applied on our routes, on this highway. If people really want to reduce some of those are very expensive. People's dying is a failure. It's a really government failure. People should not just be dying like animals. But like what Sarkozy is just expressed, these are some of the needs that people have. Like drugs are a major problem. Of course, I think they know it. They know that more than us, because people are always talking to them. People are always referring these issues to them. Drugs are a problem. Of course, we know they are expensive, and no government can provide drugs for all the drugs for its people. You know what I mean? And because we don't have a system of payment which will really bring about, you know what I mean, some form of replenishment. So that's some of the problem. But it's still within it's still the politicians. You know what I mean? Because they are still the people who wouldn't want us to charge their people. You know what I mean? So there are a lot of interests, political interests. There's also, you know what I mean, service interests, and there are a lot of human rights issues as well. So all these things are into play. So we really have to, but then what we are saying, like someone said, there are different problems in different locations. Like here, even sometimes if they have the money, but they don't have access to buying it, because we don't have those facilities here where they can go and buy. You know what I mean? And then this is why they should also prioritize more of the people outside here, outside the greater Banjul area, than equity, where they want everybody to have equal amount. You know what I mean? Of course, equity is this, but you also have to look at, you know what I mean, access. That is those are some of the major problems that we have. Like I said before, we talked about electricity. Electricity is a major problem, of course, which is also a national problem. You know what I mean? Until it is settled nationally, it will continue to be a major problem here. Like the auditors were here 2 weeks ago. When they spent almost 2 good weeks, they could not do anything. They themselves knew we have electricity problem in this area. Our generators are aged, and something like that, they can no longer serve the use. You know what I mean? So those are some of most, and then we said, like coming next year, 2025, the cost of this hospital will increase because we have new infrastructures built. You know what I mean? That will consume too much of electricity. We're going to spend too much of money to feed people. We're going to spend too much of people on overheads. Everything will increase. And currently, our budget for the past 2 years has been static, especially the other charges. Last year, government approved $7 million for this hospital for other charges. But that's where we buy all the things that we need in the hospital. Monthly, we are supposed to receive about 500 something thousand. We only got 351,000 monthly. This current year, $10 million was approved by the National Assembly. We're supposed to receive 800,000 every month. We are still continuously receiving the same 351. 351, and that is where you have to buy all your basic food, your fuel, your cleaning material, your uniforms, your anything that you need. You know what I mean? So those are some of the problems that we've been facing. We talked about this in the budget, but again, of course, when we go to there, they will also tell us they're also constrained in terms of money. So this is where the problem is. You know what I mean? So even something where the National Assembly wants to even appropriate good amount of money to you, but they could control about data. So those are some of the problems that we really have to. But what is also very important, we have to try as much as possible to also reduce wastage, you know, in our health system, because that's something also that people really have to. But then, honorable, the problems are numerous. But then, we also have to make sure we look at them. Some of the issues that Soko is talking about, these are beyond us here. But then, if you look at it in the grand scheme of things, they are very important because in the long term, they will reduce cost. But like Soko used to also be aware, this is politics now. We are in a political thing. There are a lot of things being done. They're not necessarily people don't know. You know what I mean? But we also want to also achieve, certain things outside our health. So these are some of the things that will happen, but we are hopeful. For me, I think at the end of the tunnel, I can see light. You know what I mean? So we make sure that we work towards that end level. Like we said, some of the issues like staff, specialists. That's why I'm hopeful. I said with improved infrastructure, with facilities available, automatically we will get those ones. Because people will now bring themselves rather than us asking for them. Because that is how the development goes there. Maybe in the coming year or so, we'll always sit down and we'll say, we don't need more of this people because we can no longer, you know what I mean? They might not be useful here anymore. So that is where we want to go, and then we're hopeful that it will happen, inshallah. Thank you.
Another area of importance, because people just, someone outside might think, I have gone to the hospital and I paid $25. $25. But look at the petition part below. Please. Now go back to the drugs. Go back to the investigation that was conducted, only $50. Now, this BR we are talking about.
Admission. You admitted for 1 week.
For 1 week, I have not paid now. Doesn't coincide with what you have, with the agents and resources that you have to buy. Because it's not coming from another end.
You admit a patient for a whole week. So you pay $100. And that $100 will feed you, give you breakfast, will give you lunch. Huh?
And give you the drugs.
We give you the medication for $100. And even that $100, a lot of them will tell you, but I don't even have.
I don't have. You make it of them like the army don't pay. Keep them on the fire don't pay. And the
Police don't pay.
Police don't pay. So,
but somebody, did you hear about the news yesterday? They said GRA. No. Ferries are good. Police will start paying from there. So a lot of payments are coming home.
Yeah.
Ferries for police.
No, they're going to pay before they will not pay.
Oh, okay.
Let's give Honorable the floor.
Yes.
And then later
thank you very much. It's indeed a great pleasure meeting the management of bwiam General Hospital, also the CEO. We've been hearing his name all over before he came to bwiam, especially Almammeh Foundation, then now General Hospital. The reason why the hospital is at this level because of its tireless effort. Sometimes as I do tell people, if Allah, if God wants to set a direction of someone, a hard-working guy, he will push him from where he has started. He will think that this they've closed or made a stoppage to his work. But this is also a better beginning for him to be within our midst. And we've seen when he came, the changes that he's doing to the hospital. Most profoundly, I would say congratulations. And also, we are happy to have you in our Fonies. And we have said, Foni is of, I can even say from bwiam down to Sol. Because these are the key areas that also involve this facility. And the congestion syndrome, as we said, Honorable Minister, if bwiam is fully functional and it has all what it takes, you realize that the Dembans will be history. The Banyons will also be history, and even the Carnifing will be history. But most of the key areas will travel far to this end. And health services is expensive. It's an expensive thing. Health, you could equate it with security. Because today, if you talk of a pistol, one pistol, how much does it cost? And now some of these essential tools that you'll be able to do, the apparatus that you'll be able to do your hospital work, one alone is millions. And now, as you look at the input services, today, as a security person, the the pistol will not give you money. It's only to secure. The tools also that you have, the apparatus that you have in your theater, will also be able to do the key issues that are needed. But if you want to generate money out of it, you either privatize it. And this is not the use of government, this is not a private hospital. So these are key factors that are there, and I think it's also very important. That's why I said, when I took over as National Assembly members, I do go around, security persons in the phonies, and also I also said that by Friday we'll be sitting on the budget. I will not be calling CEO, what are your concerns, what are your problems? I want to see. You remember the day that I came here, I think when we went around a program here, I was shocked when I went to some of the areas where nurses were sleeping. I took pictures. When I went, we are about to start a session. I confronted the minister. I said, these are issues that are happening in my area. And I think I'm ready to go ballistic. That was when he contacted Nyasi and see. Because these are our responsibilities. We are the representatives of the people. And we will only make people to understand when we see things with voice out. I know hospital staff will not be talking about that, but for us, this is our aim. And the issue that we come and see, we go to the authorities. There is an open door policy within us and ministers. As we say, we have also discussed with the Minister of Higher Education. Because what I would also seek for us to assist them is for example, your budget, if you have a sample of it, so those will be advocates. And what he has said, when you phone in now, so we are into different committees. We have 2 National Assembly members who are in the health committee. So sometimes what we do is organize